So next talk will gel well with this presenter's talk. Dr. Rakhi Dcruz will be talking on navigating mental stress and burnout in use.
Good morning, everyone. I'm Dr. Rakhi Dcruz, and I'll be talking to you on So I'll be talking to you on how to tackle mental stress and burnout, especially in young ophthalmologists. So stress, as we all know, is an inevitable part of life. We surgeons are more prone to stress because our actions or lack of actions can have a serious impact on patients' life and their vision. Yet the effect of stress is seldom acknowledged and formal training to manage is rarely offered. When we are stressed, our body thinks that we are in a fight mode. It releases a complex mix of hormones and chemicals such as adrenaline, cortisol, norepinephrine to prepare the body for a physical action. Stress is a key for survival, but too much stress can be destructive. Daily occurrence of stress finally lead to a weakened immune system, high blood pressure, fatigue, depression, and is a major risk factor for cardiovascular accidents. So how to spot this stress and how to prevent burnout? Burnout means it's a state of emotional, physical, and mental exhaustion which is caused by a prolonged stress. Don't tell me that none of you were stressed in your early days. Everybody will be stressed. Everybody might have faced these burnouts also. So recent studies shows that young doctors are more facing burnouts at the range of 40 to 60%, and females exhibit more burnouts than their male counterparts. The psychological stress was greater among trainee surgeons and junior surgeons and experienced surgeons. So how will you spot that whether you are stressed or whether you are in a phase of burnout? First of all, you'll be having an evening headache, you will having unnecessary muscle tensions and muscle pains, you'll be starting to neglect your self-care, there'll be a lot of negativity going on in your life, you'll be irritable for no reason at home, you will feel blunt emotions, you will feel helpless and drained for no reason, you will have endless anxiety even for nothing. You will feel overly tired at the end of the day. You will finally having insomnia. And there will be a feeling of numb or apathetic about life. So causes of stress, as we all know, in the early phase it is a workload, long working hours, solo practices when you have high patient volume, emotional exhaustion due to your own surgical complications and the patient suffering. Lack of support can be due to insufficient mentorship, administrative support or financial support, administrative burdens like unsupportive senior doctors working with you, toxic work environment, unhealthy competition that is going on among colleagues. So it can have an impact on your patient care. It can cause to more and more medical errors, surgical complications. It can lead to personal consequences like you will have a strained relationship, you will have health issues, you will have loss of job satisfaction, and you go on switching your job. So I'll be dealing with strategies to prevent this. First of all, you have to love yourself. Whatever you are, however not well-trained, however you feel like I'm not a good surgeon, I'm not a good person, whatever it is, start doing self-care practices. Everybody will tell, I'm so busy, I can't find time for self-care. It is nothing like that. You have to find that time. 30 minutes a day is well enough. You'll have to find a hobby for yourself. Painting, drawing, yoga, exercises, cooking, anything can do. Find your own relaxation technique and just try to keep 30 minutes a day for that. Work-life balance. I'm a person who is very much strict on work-life balance. I try to find a balance somehow. So first of all, the thing is that you need to say no to many things. You have to set your own boundaries. I have also learned this recently, but this is actually working for me. Ask help if you feel overwhelmed. Switch yourself off from work when you are at home. Change the workplace or shift the institution if you find that the workplace is toxic. Take breaks. This is very important. Rest and recovery is very much important. So what I do is if I have a long OT list on one day, soon after seeing the post-op on the next day, I take a half-day leave. Sometimes I'll go a little early at 3 o'clock. Go, take rest, sleep, or just watch something in the Netflix, chill. I need a break. Or else I'll go on vacations with my family on the weekends. It helps you recharge and revamp yourself. Peer support is also very much important. You need to find a building, you need to build a supportive work environment and start delegating tasks. Let go of your perfectionism. Coming to mindfulness, a mindfulness is a method in which you are staying in the present. You are acknowledging the life as it is. So how to be mindful? For being mindful, what you can do is take a seat. So what I do is, if I'm having a long OT list, 10 minutes before going to OT, I go to the HFA room, which is dark and cool, and there is a very comfortable couch there. I sit there comfortably. I'll choose 5 minutes or 10 minutes, set a time limit, whatever it is. Just feel your body, start feeling your breath. So there is a technique which is known as a 3-step breath, in which you sit comfortably. First, you press down your lower abdomen, take a deep breath, then your upper abdomen, second breath, third, your chest. So this is a 3-step inhalation, and then give a long exhale through your mouth. Just do this 3 to 5 times before going to your OR. However experienced surgeon you are, this is going to make a lot of change. And there will be times when your body will wander, you will feel like you have lost your attention, but don't judge yourself, be kind to your wandering mind, and then come back. There is a lot of benefits for practicing this mindfulness. It will improve your awareness, reduce your depression, and boost your focus in your surgeries as well. And there are times after doing all of these things, still you are burned out. You need to get professional help. There are a lot of counseling and meditations. You can also talk to your seniors. They also have faced similar situations. They can help you out. So to conclude, stress management is directly related to your surgical performance as an outcome. So you need to start practicing it, starting from your training career. Call to action emphasizes on need for systemic changes. Encourage, reinforce the importance of seeking help, and prioritize your mental health being above everything. Thank you.
Thank you.